Good morning. I am Monica Baskin. I'm from the Division of Preventive Medicine at UAB, and I think I'm supposed to be here on the program to give you a little bit more of a context for why the work that's going to be done here is really important. And after hearing from Drs. Garrison and Watts and our mayor, I'm not sure that I'm going to be hitting on things that are much new, but I'll just kind of emphasize the things that we've already heard. So in addition to the economic development, the jobs, the increase in productivity, the beautification of our city, there are some direct health benefits to the work that we're talking about in terms of sustainable smart cities. So I'm going to highlight a few of those things for you today. After I get some technical assistance. So I'll have my own personal assistant today. So one of the main things that I was going to start off with is a quote from Dr. James Marks, who's formerly the Assistant Surgeon General and is currently a Senior Vice President for the Robert Wood Johnson Foundation. So a few years ago, he was quoted as saying, as it relates to health, it's actually more of your zip code rather than your genetic code that makes a lot of the difference. And he went on to talk about an example of Detroit, Michigan, where, within 139 square miles and over 900,000 citizens, there was only 5 grocery stores in that area. And so the idea that we get these prescriptions about, an apple a day keeps the doctor away, but it assumes that then you will have access to that particular product. And that's what we're talking about today, is that when we're thinking about sustainable smart cities, we need to make sure that people have access to all the things that may improve their health, their quality of life. So Alabama as a state is used to a lot of wonderful back-to-back championships, but I also have here a couple of things that we're probably not as proud of, things where we are also on top. So we consistently rank very high in terms of lots of chronic conditions, things like obesity, diabetes, cardiovascular deaths, cancer deaths, smoking, as well as the mayor was talking about before, we are repeatedly ranking very high in terms of our air pollution. So this is a slide that is a graph that is borrowed from data by the Jefferson County Department of Health that lists some of the leading causes of death related to chronic diseases. So these aren't all of them, but they're the ones that are fairly pronounced here in Jefferson County, and they mirror the state as well as nationally. So as you see here, most of our morbidity comes from things like heart disease, cancer, cardiovascular disease, and COPD, as well as renal disease. And most of these conditions are as a result of things that we consider to be modifiable risk factors. So things that you can do something about to help prevent these issues, but these are the ones that are leading causes of death in our community. So then what I want to briefly talk to you about is, as we think about the things that we can do something about, those modifiable behaviors, here's some data that will support why we are all here today. So for example, we know that when there's an increased availability of supermarkets, that's associated with healthier diets. So again, an apple a day keeps the doctor away, but if you have access to those supermarkets, then you're more likely to follow that prescription. We also know from research that communities and neighborhoods that have a high amount of fast food density, so hopefully none of our communities here in Birmingham are that inundated as the picture is showing, But there are certain communities and certain areas where there are more fast food outlets than there are any other type of retail. And so when those exist, that's also linked with unhealthy diets and poor lifestyles. And then lastly, children who are living in communities, again, with the high fast food density, but also when they are near lots of convenience stores, are often less likely to eat their recommended amounts of fruits and vegetables and other kinds of healthier foods. With respect to physical activity, we also know from the literature that the built environment can make a very big difference. So on average, people who live in neighborhoods that are walkable tend to get 15 to 30 minutes of extra physical activity a week. And over a year's time, that can amount to about a pound or so of weight loss. We also know, as was mentioned before, in terms of what the mayor has done down in the new Hope 6 development, is that when communities have this mixed sort of retail housing environment, that those tend to be more conducive for people to walk. People, when they have this mixed retail space, they are walking not only for leisure time physical activity, but they're also walking to a destination, and that increases people's physical activity. And then we also know that more kids are likely to walk to school when there are sidewalks and when we have safer pedestrian ways for them to get across the streets to go to school. And then lastly, we know, as was mentioned just a minute ago as well, public transportation users are also more likely to get more physical activity. So again, not new in terms of some of the things that we've talked about already this morning, but certainly providing a little bit more evidence in terms of what the research is showing us. I'll also go on to obesity. And so for those of you who have seen a lot of those CDC color-coded maps where you see that the Deep South in general, but particularly Alabama, has had a significant increase in obesity over the years. Again, we find evidence in the literature to suggest that the built environment has a role in terms of increasing weight as well as helping us with reducing that. So one of the things, again, people who live in neighborhoods with, again, this mix of retail and housing tend to have a 35% lower risk of obesity than people who live in communities that don't have that mixed use. We also know that the risk of obesity for people who are living in more pedestrian-friendly environments, so places with sidewalks, walking trails, parks, and so forth, less likely to be overweight. So the difference between someone being in one of these more pedestrian-friendly environments versus someone being in a low-friendly, pedestrian-friendly environment can be as much as 8 pounds difference. And then lastly, for those of us who do a lot of commuting, what some of the literature suggested is that for every extra hour that's spent in your car commuting, then in fact there's a 6% increase in the likelihood for you to be obese. So again, taking it personally, there's even more greater motivation for us to think about ways where we can use mass transit and other things to get us off of the streets. And then that links us very nicely to the air quality, and again, what Mayor Bell was talking about as well. So we know that a significant number of cancer deaths are related to environmental exposure. So things like radon exposure, but also in terms of tobacco. And so even yesterday, there was a lot of a public discussion around some of the planned smoking bans and the talk about secondhand smoke and how dangerous that can be. And so that is, again, part of the built environment, some of the policies that may be in place to help reduce exposure to these toxins that may eventually lead to cancer. We also know that breathing unhealthy air through the high traffic has significant implications on a number of conditions. Asthma, I think most of us would probably say, okay, that makes sense. But there's also research to suggest that this exposure can also influence the development of diabetes. It also can lead to or increase the risk for heart attacks, premature births, and infant deaths. So again, a number of things that we're not necessarily thinking about. When we think about the rich history of Birmingham, as the mayor was talking about, it really was about prosperity, but there may be underlying and long-lasting implications of the work that was done before. So to kind of wrap up and conclude, as we think about the rest of the day, and we hear from a number of national and international experts about what things we might think about for our city and what things that have worked before, I also encourage us to think about not only the sustainable, smart cities, but putting the health as a forefront, in the forefront of that sustainability. And what do I mean when I'm talking about a healthy community? A healthy community is really comprised of a number of different things. It's including, making sure that we're providing the basic needs for our residents. So we're talking about food, shelter, but also work. So thinking about, what kind of jobs are available for people to have that higher quality of life. We're also talking about quality education and learning that occurs across the lifespan. So again, thinking about, from preschool education all the way on to continuing education in senior centers and so forth. But an educated population is also going to be more likely to be a healthier population. It's also important to have access to adequate healthcare services. Again, it's critical that people who need to receive both preventive care as well as emergency treatment and other kinds of treatment for chronic conditions, they have access to that in such a way that it is timely and it matches their needs. We also need to protect our natural environment. So again, one of the things when my family and I moved here to Birmingham that we really hadn't taken in a lot on our visits here before we moved was just the natural beauty that's here, from greenery to the, to lots of different things that are here. We want to make sure that we're preserving that so that generations long after us will be able to benefit from that as well. And then we have a healthy community is one that fosters connectedness. So we don't want to be in isolated pockets so that there are certain people that live, over the mountain, and then there are other people that live in Woodlawn, and those people don't connect together, they don't talk together. The types of things that we're talking about, may not fit those populations, but a healthy community is one in which we are connecting one another, we are, operating in a way that we are collectively together, we're supporting one another, and we move forward and making this a better Birmingham. So thank you very much.